I'm the officer in charge of assessment, research and partnerships. And for this afternoon, I'm the moderator for our discussion. We have 4 discussants in the panel, 5 discussants in the panel. We have Emmanuel Cassini. Emmanuel is a head teacher at Goodrich School in Kawangware, and he's one of those people who is known for being a champion for inclusive education. Emmanuel will be talking to us as an educator and a head teacher as such. And being a head teacher, then it means he carries the whole burden of what is happening to the children during this time of COVID-19, that they're away from school, they're away from their teachers. With us, we also have Grace. Grace is the director of Grace Institute. She will be telling us more about what she's doing. We also have Elvis. Elvis in the house. Elvis will be joining us shortly. Elvis is from APDK. He's the officer in charge of monitoring and evaluation, and basically coordinates all matters to do with therapy that is provided for to the different communities by APDK in Kenya. We've also been joined by Lilly Oyare. Lilly Oyare is the founder of Little Rock, and she will tell us more about Little Rock and where they are based. And finally, to complete our panel, we have Wilfrida. Wilfrida is the chief physiotherapist in the Ministry of Health. We are very delighted to have the Ministry of Health with us in the house to give us guidance, to tell us what the government is thinking about us during this time of COVID-19. That makes our panel. For those of us who are in the first webinar, you realize we're kind of going on with the discussion that we started at that particular time. But as conveners of this discussion, we felt a need to go right into the informal settlements, and we purposed to go look for the people who have been operating programs in the informal settlements long before COVID came around. And now that COVID-19 is here with us, we would like to hear their voices of what is happening with this within these informal settlements. And therefore, this particular webinar then targets specifically what is going on in the informal settlements. If the Lord wills, most likely we're going to look beyond the informal settlements in a future webinar and look at what is happening in the countryside, especially in the rural setup. With those very many words, allow me to invite the first discussant, and I will call upon Lilly Oyare from Little Rock to be our first discussant. And Lilly, you'll be telling us about, briefly, what are those therapy-related services you used to offer before COVID-19, and what services are you offering now that we're in the era of COVID-19? 2 minutes for that, Lilly.
Okay, thank you very much. Good afternoon, everyone. As you've heard, my name is Lilly Oyare. I am the director founder of Little Rock Inclusive Early Childhood Development Center. We are located in Kibera, Ayani. Before COVID, we used to have an in-house therapy. We have a therapy department where our children go for daily therapy. Some go 3 times a week, others do once a week, and also we have those ones who participate in group therapy. But with the COVID, everything has been disrupted completely. And we are getting messages from home. The first message we are getting is that the kids are hungry. So at the moment, we have been sourcing for food basket so that the kids can at least have a meal. because some of them are on prescription drugs, and others, apart from prescription drugs, some of them are taking ARVs, and there's no way you can take ARVs on an empty stomach. So the first response was for us to give out food baskets. So we've been giving out food baskets to individual children. And then the second activity which we have undertaken is the worksheets. The kids who are able to do work, we're giving them worksheets. The parents are coming on Tuesday and Fridays. For therapy, we have not come up with a concrete program. We are just doing the telephone where we are calling the parents and finding out how the children are doing and giving instructions through the phone. But it has not worked out very well because, you know, the children we are serving, they are wondering what has happened because they are so programmed in their activity of the day. And now that they are stuck at home, they're wondering what is going on. So even when giving instruction to a parent, some of the kids are not responding very well. Those are some of the things we are getting from the parents, that the children are wondering what has happened. And that disruption has made majority of them lose the milestones, like 5 steps backwards. Some of them are completely lost because they depended on that therapy on a daily basis.
Thank you, Lily, for what you've shared with us. Members, we're seeing a situation where at least parents are meeting on, you said Tuesdays and Fridays?
Tuesdays and Fridays, yes.
For worksheets.
Yes.
Maybe that's an avenue we're going to explore on whether these parents who come on Tuesdays and Fridays, apart from reaching parents on phone, maybe we could give them some therapy guidance for them to go try at home. I will not ask you to respond to that now. I'll give you time to respond to that much later. I would like to call upon Emmanuel Cassini, being a head teacher. What is it that we used to provide to the children before COVID, and what are we providing to the children now in the era of COVID? Mr. Kasaine?
Thank you so much. I'm Mr. Kasaine. As you have heard, I'm the head teacher of Godrich. It's found in Kawangware. Before COVID virus, we had that intimate relationship, that closeness with the children with disability. By bringing them together, we play together with them, sensitizing them, and even we had a small forum with their parents, whereby we enlighten them on how to assist these children. But now, due to this COVID-19 virus, it has been very, very challenging to us. Because one, reaching the parents where they are is a problem, because some of them, they say that when they see us or when they see a call from maybe the office, they think maybe they are affected by the corona, or maybe there's something that is connected with them by this corona. So it has been a challenge to even to us and even my staff by giving even the handouts for learning at their places. And it has been a big problem, because even some of them, when I try to call them, they are shunning away because they are fearing this COVID pandemic. So I think we need a lot of sensitization on how we can please educate our parents and even the people within our locality. Thank you.
Thank you, Mr. Kasaine. Grace, you had Lily has told us about the children are hungry, children are on prescription drugs. They have a system at Little Rock where the parents meet on some specific days, but there is instruction given over the phone. But she raised this alarm that the children have gone 5 steps backwards. You've also had Mr. Kasaine say that in Kawangware, even receiving phone calls becomes an issue because somebody might be fearing that you're calling them in relationship to Corona. And because of that, then they've not been able to reach out to the households. What is Grace Institute, and what is it that you've been doing before Corona and during Corona?
Okay, thank you so much for having me on board. I'm Grace Barbara from Grace Institute. We are based in Sophie near Mombasa Road. Before COVID, we had children with special needs who we used to take for therapy, and we used to take them to KISE every Tuesday from 9 to 12 every Tuesday for therapy. And they had really come up well, they were coping well, and they were enjoying the sessions, and they were opening up. One has autism, and the other one has actually there are three. One has autism and two have cerebral palsy. And they were able to really like come up with through the therapy sessions. So when COVID came, number one, social distancing, so we couldn't go to KISE anymore. Then there was the bit of staying home. So of course, everyone shut their doors, starting with me. The school, the children had to stay home. So immediately there was nothing that happened. Then later I started calling now the parents of those wonderful children to find out how they are. Initially, it was a bit of a challenge, but because the parents were home with them, had gotten a bit of what I used to tell them what happens at therapy, they started doing it themselves, what they could. So like my children have improved in most in physical activities because they're able to do them with their parents. They've improved in feeding. One of them, the mom called me and gave me a praise talk because the girl has started walking after she started using the treadmill at the therapy sessions in KISE. So she started getting confidence in her legs, and they continued doing that, and now she can walk up and down a fleet of stairs. So I was so excited. So for them, it's been slow but steady. They're enjoying the process with the children. I'm missing the children, but at least the parents are engaged to those children. Greatest challenge, some therapy sessions, they were hoping they can be done online, or if we can send them like videos of exactly how to do like the physical therapy, especially so that they know how to roll the child on a gym ball, how to help them jump on a trampoline, an in-house trampoline, how to use their hands, and cognitive things that they can do with their children at home. And I thought that would be an awesome idea if we can come up with videos that can help parents to do therapies at home, since some, like for Lydia and Emmanuel, some are avoiding phone calls, some are scared of the response of the children, or the children are not responding too well. When they see a familiar face that they saw before, doing the therapy on the video and then now connecting with the parents, I think that would be so cool and so awesome. So on our end, it's 50-50. There's some praise reports and there's some downside of it because they can't access real physical and professional, not really physical, but more of professional therapy. Yeah.
Thank you, Grace, for the sharing. Maybe in round two, you will tell us more about have you been able to meet the parents face to face after you said when COVID came, we shut our doors, everyone, but
Yeah.
so we want to hear the but. Have you been able to visit some of the parents, or have they been able to meet somewhere so that we can you can check on the gained milestones? I wish to bring on board at this particular point Elvis from APDK. And as Elvis comes, I will still seek that we try and keep our mics on mute so that then we're able to hear the speaker well. Elvis, this is our second webinar in the series that we are hoping to have. And why we are having this particular meeting, apart from the information you got about what is happening as far as provision of therapy to children with disabilities in the informal settlement, I said this is the second one. And the first meeting we had about 2 weeks ago, we had parents who are trying to do something for their children, but there was the issue of the parents didn't know exactly what exercise to do with the child. And we had parents who maybe they have more than one child with a disability in the house. And the parents that were starting to get overwhelmed, tired. And lastly, there was the issue of, as much as there is some recorded therapy sessions like we had, since International has some YouTube and so on, a few people have been sending their clients some information on smart gadgets. The parents said, you're watching the video and you're trying to do this on the child, and it becomes a little bit hectic. As an officer from APDK and one who walks, drinks, thinks throughout about therapy provision for children in Kenya, what's your take about therapy at this era of COVID-19? Elvis, thank you. Please unmute yourself.
Good afternoon, Lydia, and good afternoon, the rest of the members.
Good afternoon.
Thank you for having me on board in this meeting, and also having APDK as an organization to take part in this very important meeting and discussion. Just to make a small introduction and probably a snap information about APDK and myself. As you have introduced me, I am the M&E officer, APDK nationally, and also I have the background of being an occupational therapist, registered and practicing. So APDK ideally is an organization which promote the quality rehabilitation services through medical rehabilitation, social rehabilitation, economic empowerment, and above all, also on production of mobility and assistive devices. We run a network of 10 branches nationally, covering approximately 35 counties in this country. Just maybe a quick mention of the areas we are in nationally for us also to have a picture of APDK as a whole. We have a branch in Nairobi. That is the headquarters of our organization in Nairobi, Westlands ABC Place, just within the disability compound next to the National Council for Persons with Disability. We also have a branch in Nakuru, Eldoret, Machakos, Embu, Busia, Siaya, KISE, Kisumu, and Coast Branch. Now, just going straight to the point that you have asked me to highlight. As you have mentioned, APDK is a service delivery organization. We give out rehabilitation. So we have been affected seriously by this COVID pandemic because immediately it came in, quite a number of things had to change, particularly on therapy services, which is our discussion of today. Right from the beginning, we start as an organization and try to look at what can we do, because life has to continue for persons with disability. Despite of all that, we suspended some of our programs from going on as it has been a routine, particularly on areas, on programs which calls for maybe clients to assemble or clients to have maybe crowd. So for instance, mobile clinic and outreach service programs were suspended in all our 10 branches. Also, we structured how, okay, we suspended for some few days also on therapy services, that is giving out direct therapy services to our clients who have always been coming. And then there was a big outcry from our clientele. And then we sat down and say, with these instructions and the preventive measures that government had laid out, we say that we are going to keep out the essential services, that is rehabilitation essential services, because you could put yourself in a situation whereby a client, like a child who has been undergoing maybe a condition like clubfoot, for instance, and being on a serial casting, stopping that client maybe just not receiving the treatment, which cannot be given out by the parent, would really bring maybe other complications and probably bring in regression or probably issues to do with the condition. So we opened up and offered out essential services, like putting in place, of course, measures that would really not expose somebody to the COVID-19. Am I clear? Hello?
Yes, you are. Elvis,
yes.
We are very keen. We are really
okay.
following.
You know, sometimes okay, thank you so much. So we put in place measures. For instance, in areas of our service delivery, we ensure that for every client that comes in for any treatment or any service has to be an essential service. Two, we put measures in our service delivery points. For instance, all the staff who are giving out the service have to be on the right gear for them to deliver services, and also making sure that we follow the guidelines. I don't want to go that direction, but the challenge that also came in again was the stigma that is related to COVID. Immediately that this pandemic came in, there were a lot of reactions, and even there was a stigma which was related to this. Even now, there is still that stigma whereby you could imagine a child with cerebral palsy, with maybe probably a flu, or maybe allergy, just sneezing. It brings maybe an attention to maybe the neighbors and probably say and see it as an issue which is like stigmatizing the clientele. Another area that which is also a challenge was managing in between the observing the directives and giving out service delivery. So those were the issues, such that the client has to receive the service, and on the other end, you must follow up the correct procedure. So those are the challenges that we had as an organization, and also the challenge accessing therapy in our facilities. Thank you so much. Maybe I can expound it later on the other areas.
Yes, Elvis, I think from where we sit, and those of us who are listening to you, we are 34 participants. Yes. We could give you the whole day to continue telling us more, because you resonate with our needs. You've used words like the client's cry, there was an outcry. Yeah. There is the use of the word essential services. Wilfrida, because she will be responding to this. She is our guide from the Ministry of Health.
Yes,
So there
yes.
is the issue of the word right gear.
Yes.
There is still the stigma related to COVID-19,
Mhm.
but the tricky balance that is there between service and government guidelines.
Yes.
And as we talk about this service, I go back to what Lilly said. Children have lost steps backward. But at least one thing we are in agreement is that there is the issue of service and the
Yeah.
balance between service and the government guidelines.
Yeah.
Madam Wilfrida, Daktari, this is your opportunity. Please, as you address us on these services, also pick out those very loud things that Elvis has brought out, and considering that there is an outcry, and that is why we are in this office this afternoon. Wilfrida from the Ministry of Health is the chief physiotherapist. Madam Wilfrida, the opportunity is yours now. Wilfrida? I
Hello?
will ask my colleagues to get for me Wilfrida. She
Yes,
was on.
I'm on board.
Yes, I've seen you. Thank you. Thank you.
Can you hear me now?
Yes, we can hear you.
Okay, thank you. Okay, COVID-19 came with a lot of challenges, and it came with a lot of fear as well. So in the beginning, it was all about stay at home, work at home, and so many services came to a standstill. But I want to say that the hostel services were still running, except that because of fear, many people were not able even to go to the hostel. Like parents with children with special needs were not able to come to the hostel for the services. And so a lot of things came to a standstill. But I want to say that during COVID, the departments of rehab, especially the ones in KNH, the Kenyatta National Hospital that I know of, they were trying to reach, the clients tried to reach the therapist by phone. And so there was instructions through the telephone. Or sometimes the therapist called the clients that they knew that were really in need to just ask how they were doing. And so from there, they gave instructions on what could be done to the children. But I want to say again that the hostels are open. And right now, the fear of COVID has gone down, and people with comorbidities or any other issue need just to take courageous steps and go to the hospitals for care. The government is trying to work on what we call universal health care. And within the universal health care, a lot of community health workers have been hired. But from the rehabilitation side, we are trying to impress and you compel the government also to hire the rehabilitation team among these community health workers so that children who are in disadvantaged communities can still get access to therapy. So drastic changes came with COVID, but the fear is going down, and we are hoping that in the long term, we are going to be able to have rehabilitative teams within the community health workers who have been hired, because these were hired mainly to help people with their hygiene, hand washing, social distancing, and public education. But when we realize again about social distancing and the children who had issues and the parents and children who had disability, it was very challenging. All these guidelines that came with COVID were pretty challenging to parents with children with disability. But we hope that that is now being taken care of. Hello?
Daktari, we can hear you, Daktari.
Oh, yes.
I'm seeking that if you could elaborate a little bit more. You've used words like, okay, COVID-19 came with a lot of challenges, but you have also emphasized hospitals are open.
Yes.
And now then we are asking, our children that we cater for in therapy are not necessarily sick. But
Yes.
as Elvis and the other colleagues have said, Grace and Lilly, these are children that have milestones that they were gaining as they were going through therapy. And right now, Lilly says they have lost those, some of them have lost those milestones. And you heard Elvis say that therapy became an essential service. As much as they had stopped it in the earlier days, then there was a lot of cry and it became an essential service. I am not really pushing you to say this is the government stand, but what is your advice to us as service providers? Because most of us in this meeting, I can see, I appreciate we have some parents, but most of us are service providers. What would you tell us at this point, now that we've been home for almost 3 months?
Okay, that is the challenging bit. That's why I was saying the government
Yes.
is in the process of hiring rehabilitative workers among the community health workers. That will take a little bit of time because that includes interviewing the people who are supposed to go work there as rehab team, confirming that they are qualified to offer rehab services within the communities. So that may not come as immediate, but it is in the process of being worked out on. So the people who went first were community health workers, but we are in the process of also interviewing the rehabilitation, that is the occupational therapist and the physiotherapist, and also some of the orthopedic technologists, so that they are also incorporated with the community health workers so that they reach the people living within the community. So the children won't necessarily need to come to the hospital, but the health workers will reach out to them in their communities where they are. That is what the government is trying to do as we talk now.
Okay, thank you very much, Madam Wilfrida Otieno. I would like at this point, now that we've had a discussion for 30 minutes, before we go back to the panelists, I wish to call upon a few of us, we engage in this discussion, listening to our 5 panelists and now that we are thinking about our children in the informal settlements and the lost milestones like we've had, I would like to invite Carolina from SEPUM. The last time we had this discussion, Carolina, there was the peer educators that SEPU was using within the informal settlements, and there were phone calls. Could you tell us whether have we had any improvement? Have we had any parents engagement? And finally, do you think the parents now have kind of settled as far as the stigma for COVID-19 is concerned, that they would be willing to start accessing services at the hospital, as Wilfrida says the hospitals are open? Carolina from SEPU.
Thank you, Lydia, for this opportunity. Yes, so our peer educators are working, it's mainly in the rural areas that we have the structure of the peer educators. I think that we are still in touch. We call via phones, and we see that most parents are really happy with these phone calls, and they do the home programs. They share the progress that the children have made, and then they get the following advice. So that is going very well. But now to the question of if people would go to the hospitals, that was already a reason why we started with this structure, because most parents told us that it's too far, they don't have the financial means to go to the clinics or the hospitals within their area. So I think that's already, again, a situation that was there before COVID. So COVID has not helped at all to improve access. Yeah, so that would be my answer to this.
Thank you very much. I know Melen said she's at the background. I can see her. Melen, Grace had said if we recorded, if we did some recording and shared some videos, And because we are aware that Sense International has some recordings and some videos, could you be kind enough to like share the link or tell people how they can access those videos? And also respond to, Grace had said, if videos are done with familiar faces, it will be easier for the child and the parent to work together. Melen from Sense International.
Thank you, Lydia. Good afternoon, everyone. This is Melen from Sense International. Yes, Sense International has some videos that we had prepared way before the COVID-19 pandemic. And basically to guide parents, they're very simple exercises to guide the parents on how to continue with therapy at home. What triggered the videos was, you see, our donor funding has a time frame. So what happens after the donor funding has gone down? The OTs have to be terminated, or the project has to stop. So we did the videos as a sustainability model to help the parents continue doing the therapy at home. So the videos can be accessed on our YouTube page, Sense International. What I'll do, I'll copy and paste the link on the chat section. And the videos are very public. You can use them, and you can also share with the other parents or even colleagues. But if you wish to use them like publicly, sharing like maybe on TV or somewhere, at least some acknowledgement that it is done by Sense International would suffice. Otherwise, it is very free. You can share with all the parents. A disclaimer is that we do not want the parents to do therapy on our children, which might be harmful. So as you're using the videos, kindly contact also your service provider before COVID-19 to help you navigate through the videos to see how best you can use them to help your child. Thank you.
Thank you, Melen. I'm sure Wanjiro will get the link for us. And when we are sharing the proceedings of this webinar, you'll be able to get the link to the videos. But remember, Melen has said, the videos does not replace the therapist. And therefore, we shall still ask if, for example, Grace, you're to send the video to a parent, make sure that you also follow up with the parent to see that we don't hurt the children in the process. Because remember, the children, some of these conditions are quite fragile, and we have to take care of that. I wish to call upon again two people. One, I'll pick upon Stephen. Stephen was one of the very first people to log in this webinar, almost 20 minutes to 2. I don't know whether we are meeting your expectation in this meeting, Stephen. What do you pick from this discussion we are having? And would you propose that there is need for us to restart offering therapy so that we go back to Elvis, and Elvis teaches us a little bit of what they are doing at APDK to stay safe, still offering essential services? Stephen? Please unmute. Stephen? Okay, as I wait for him to unmute, I'll ask Paul Mugambi. Paul Mugambi, that is human and inclusion. You were also an early entry into this discussion. Where are we in space as far as offering therapy for children who have been undergoing therapy, and there's this fear or this perception that they're losing milestones, and then the parents cannot automatically become therapists, as we were told in the other webinar by one Ivan Aptuni, that parents are parents first, and then about becoming therapists is another issue. Paul Mugambi.
Thank you very much, Lydia. First, I'd like to thank you for this webinar. It is educative, and I would like to raise the following issues in terms of therapy. It's critical that we ensure that therapy is followed up, and children with disabilities or persons who need rehabilitation are supported. But one thing which I would like to make a follow-up with the chief physiotherapist is a concern about the protocol about rehabilitation. Because if we don't have a protocol, you find ourselves that not so many people are aware about issues regarding what needs to be done in terms of the policy guideline and what people need to observe. And for the purpose of ensuring that persons with disabilities or even children with disabilities awareness is created, we need to hear more vocalization of these issues about community workers to be employed, and specifically because many people are not, they don't know about therapists, they don't know about whether it is occupational therapist, whether they physiotherapist or even orthopedic technician. People just know about nurses, doctors. So when it is not being spoken out, these are the issues which make some of these issues not to be spoken. So it's a critical issue that our chief physiotherapist comes out clear also to develop a clear protocol which can be used by different policy stakeholders to engage government at different levels, whether it is at the county levels and at the national level, so that when we are talking about therapy, people are aware, because not so many people are aware. For example, right now we are talking about just children, but there are those people who have been affected by COVID-19 and they have gotten disability. No one is talking about them. How are we handling them? There are some people with disabilities who have faced, who have been affected. I remember there's a case of a deaf-blind person who I was following up and until he was released from the quarantine center, just because that these people who are at the quarantine center didn't have proper persons to guide this individual to know what he needs to be done to this individual. So it's a question of also having policy guidelines which are inclusive. And I believe that we would like to see like a rehabilitation protocol which can really specifically talk about therapy and not just physical therapy, also other disabilities who need therapy. Because sometimes people think that when you talk about therapy or rehabilitation, we are referring to persons with just mobility impairment, but we also have maybe persons who have sight impairment, who need rehabilitation, and such things need to be considered. Thank you.
Thank you, Paul. Thank you very much. Yes, site rehabilitation. I know we do that and other people do that. And definitely there is issues of somebody who had already started gaining some milestones and now they feel they are losing them. It's a discussion that needs to be held. Wilfrida, we shall be coming to you on matters of protocol in our second round. I would like to engage two more people and then we come back to the panelists. Faith Nyamboke. Hoping that your internet is not going to string us. I know you've been doing therapy for children with autism in conjunction with the other the physiotherapists on the ground. What would you say about offering therapy services in the era of COVID-19? Faith, please unmute. Yes.
Hi, thank you for this opportunity. I don't know if you can hear me clearly.
Yes, we can.
Okay, during this period, basically, it's been a little bit challenging for most parents, considering the routine when it comes to children who are in the spectrum, the changes of routine when it comes to school, those who've been accessing the therapy services, it's become quite a challenge. Most parents call and ask now, what is the next option? What is the next best thing that we could be able to do in order to help our children? So just as I think it was Grace who had talked, I joined later, a little bit later. Grace talked and said that if we can do videos, if we could be able to do them so that the parents can access them, it's something that it would be great. But then again, we also have to remember that parents, just as it had been said earlier, parents can't be therapists at the end of the day. There's the tension, there's also the mental aspect of it, the psychological aspect of it, of changing everything that comes into the child's life. Because being in the field of children in the spectrum, you'll find that if I am used to it. This is a child. If this is so and so who touches me and does my therapy, and then somebody else comes in, it takes time for them to change or to transit to something next. So it has been quite a challenge. And it's my prayer that if there's a way that we can be able to help these parents and children at the end of the day, it's something that I hope the government, I don't know how it can be done, but I hope these children can be able to get the services that they require, because I believe it's also an essential service for them, just as each and every person is receiving another service like health. It's part of their health, I think so. Thank you for the opportunity.
Elvis and Wilfrida, you've had therapy is an essential service. I have seen a few of my colleagues with their hands raised up. I'll pick at 3 and then we will go back to the panelist. Alphonse Martin, your hand is raised up. Something is burning. You have your minute.
Hi guys, thank you for the opportunity. I appreciate that. And thank you so much for having organized this. I was not in a position to attend the first session, but luckily I'm here today. And from the discussions, rehabilitation is an essential service. And I can say that with a lot of authority. I'm a physiotherapist myself. I work for AFI Africa. So we've been doing mostly continuous medical education to educate therapists all over the country, as well as doing pro bono community rehabilitation, where we treat patients with all sorts of musculoskeletal, chronic conditions, non-chronic conditions as well. Yeah, during this period of COVID-19, a lot of the services or rehabilitation is looked at and is usually forgotten as a very big and important component in healthcare. And I feel like since we are already a group in that space from different institutions and spaces with different expertise and specialties, then if we can all come together and help come up with documents, or rather some of the shortfalls or pitfalls we are observing as individuals and as a team, and write to the Ministry of Health to ensure that rehabilitation is factored as a very key essential healthcare service. And it doesn't matter whether it's a physical therapist, an occupational therapist, a special needs education specialist, speech therapist, music therapy, art therapy, all that is considered rehabilitation. And if you look at our space as rehabilitation specialists, we are also key.
20 seconds.
We are also key in terms of prevention. So I hope that from these meetings we can be able to come up with a way forward in terms of making rehabilitation at the forefront of healthcare.
Thank you, thank you. We now give 1 minute to Evelyn Bone. Evelyn, your hand is up. Evelyn, please unmute.
Thank you so much. I was raising my hand because I had not yet joined, but I'm okay now. Thank you.
Welcome. Stephen, your hand is up.
Yeah, sure. Okay. Hi, everyone.
Hi.
Midudi Stefan. It's my pleasure to join you. I'm joining you from Tanzania, basically.
Yes.
And basically what we do, we do a lot of albinism inclusion, that is a link project.
Yes.
But currently also, I got the link through PFPID, which I'm a fellow currently. But I wouldn't want to basically duplicate what has been said, because I've realized that the session is more enriching, and I would like to do more of listening, because we are listening to our experts who spoken before.
Yeah.
But I think my concern basically is because right now with the COVID-19 and the quarantine situation and the guidelines given by the government through Health Ministry,
yeah.
I think everything is now moving online. And just as the first discussant has said that we will recommend for recorded video sessions for therapies to be used at home. But I will say again that we should look at the situations that come along with that, especially what Emmanuel mentioned earlier on, that you realize that the children develop some psychosocial support, any problems, as he put it, that whenever you give them phone calls, they fear picking up because they think maybe it's something related to COVID-19. I think again, if we are going to do those video sessions, we should have time, to engage some psychosocial support to the family members and of course the victims, or in this case, children living with disability in those informal sectors. And again, we realize, living in informal sectors, there's some psychosocial support that comes with it. Basically, what I'm talking about, you see, there's that trauma of living in the informal settlement, and the COVID-19 pandemic, I think, just worsened the whole situation. And I think if we are going to help, children living with disability at the informal sectors, if we are going to do it with recorded videos, then we should incorporate some sessions again of psychosocial support. And again, as we were saying, the video session should not replace the therapist. Okay, sorry. It should not replace the therapist, because the parents cannot do it the same way therapists will do it, because they have that empathy, sympathy effect.
Okay.
My time is over. Thank you.
Yes. Thank you, Stephen, and thank you for joining us all the way from Tanzania. Members, we are going to back to the panelists, but I would like to draw your attention to the chat. At this point, I would like to welcome Victor from TAF to tell us about the survey that we are running for 1 minute, and then we go back to the panelists. Victor, if you can hear me.
I think Victor has stepped out. I'll take it. This is Maria Omare. Once again, thank you so much for joining us. I'm learning a lot from all of you, and I'm sure we're all being enriched by the conversation. There's a very, very short survey. It just has 3 questions on the quality and any feedback you may have for us for this webinar. So please fill it in. It's 3 questions, and I promise you it will take 1 minute to fill. So thank you and welcome once again.
Please remember to fill the questionnaire there's a link on our chat. So as we are proceeding with our discussion, our listening, please go to the chat, click on it and answer those 3 questions. I wish to go back to the panelists, but I will also ask the counselor in the house, Madam Josephine Karari, to psychologically prepare to give us a word. And I will also, if time allows me, I'll be calling on Eva Naptuni. Eva is always a resource in very many forums, and we would like to hear, now that she was in the first webinar, she's in the second webinar, are we moving forward? I go back to the panelists, and I will start with Emmanuel. Emmanuel, you've had the discussion, you've heard what people are saying. What is the way forward when we are thinking about children who require therapy? You told us that these children, they enjoy playing together. You would get forums where you would have the parents and you'd be able to share and build some capacity in the parents. What is the way forward as you sit in Kawangware? What do you think is the way forward for these children that you have in and around Kawangware? Emmanuel Kasaine, please unmute.
Thank you so much.
Yes, you are unmuted. Yes.
Now, the way forward concerning the CWDs, I think what we can do maybe in the place that I am right now is by enrolling the children who are special in a way, maybe in project schools, and establish a therapy center whereby they can access and then enroll somebody who can be there for them and give them those services. And apart from that, having sensitization on seminars and training, counseling to boost the esteem of these parents, because some of these parents they are living in slums, and we find that by this COVID-19, it has drastically make them at least even shun away even from other people. And you find when we get some people who can come to them and talk to them in a way whereby that you can't just go there with bare hands, but with something, for example, like a face mask or sanitizers, because even some of them, they can't even afford that face mask, because you can find somebody who is doing this casual work, and for example, in Kawangware, there are no places whereby there are those jobs there, because you can bear me witness that Kawangware now is an area whereby it has a very high increase of the COVID virus number. So by doing this, helping them and even having vocational studies for CWDs, especially this one will enhance their talent, because some of them, they have talents, like for example, beading, singing, even playing ball. So when we have this vocational training, even if it is for 1 week or 1 day on a Saturday, we bring them together and then share with them, to find that we are going to boost their self-esteem, and this will uplift even the life standard that they are living at their homes, because these parents, they are really going tough time in their places. For example, like yesterday, a parent called me and he told me that if I have something to give, because she has a girl and the girl is around 14, she's now now the adolescent stage, and you find that with these children, find that parents now they are fearing, how am I going to approach this child? How am I going to tell this child these things are being used in this manner? So those are the kind of scenario that we are going through. But if we have at least people who are coming to us, especially having like a forum with the teachers first, then giving them at least inputs on how they can reach these parents, I think that will be the first point of at least being closer to them. Thank you.
Thank you, Emmanuel. What I've picked is if we could have projects of therapy where we have therapy centers, we could have the meeting with the parents, because you've noticed that there is increased stigma, and that way we can be able to train parents. What I hear you bring out loudly is that there is need for us to meet. The issue is government has talked about meetings, but I would say that government has not banned meetings 100%. At least government has allowed us a leeway of meeting a few people at a time. I'll be going to Elvis and Wilfrida, and I'll also be giving the perspective from where I sit. But what comes out from Emmanuel is the need to meet. Lilly, you've listened to us. You've listened to the participants. What is the way forward?
For
Lilly?
me,
yes.
Okay. For me, where I'm sitting, I like the conversation that the government is thinking that therapy is an essential service. So it's a good place for us to start, that therapy should be considered as an essential service. And most of the time, when we are talking about services, we tend to forget children with disability and people with disability. Like now, my colleagues are talking about videos. Imagine this parent in the informal settlement. How will they access this video? After getting the video, how will they use the video to carry on the therapy? So I think with the government regulation, we can be able to come up with the structure whereby the parents come in intervals, like after every 45 minutes, you have a parent coming in, the equipments are sanitized, and the therapists have the right gear. So for me as an institution, I'm looking at equipping my therapists with the right gears so that they can serve the parents. And then also the information of keeping the distance, wearing of masks, I think will have to be repeated over and over and over to the parents so that they are comfortable that even if they bring their children to the center for the essential service of therapy, they will be confident that their kids will not end up getting the C19. Another thing is the meeting of parents so that there's that parent support, because the houses our parents are living in is a 10 by 10. So imagine confining 10 or 7 children and one of them has a disability in 10 by 10. It is quite difficult for these parents. So they also need a place for debriefing, a place for sharing experiences, and just listening to somebody telling them that it is not all over because of COVID. So I think the chief therapist should bring our case forward and ask the government to allow some of us to provide therapy services to our children, or else we are going to lose them because they are going through depression, and because they cannot speak, they cannot express, they will just fizzle out, they will just disappear, and we'll lose quite a number of them. So will KISE please forward our story, because we do not know when the government will open up the schools. So we don't want to lose our children. Another thing which I can add.
The last one?
Yes, the provision of bundles to our therapists so that they can be able to communicate with their parents, and even credit for calling the parents, because all those things are the contributing factors that some of these kids are not being reached. Thank you. And the vocational activities, like now for us, we have introduced making of mats so that the kids are just kept busy. They are not just there staring at the walls. Thank you.
Thank you, Lily. I love those practical things that I'm hearing from what Emmanuel has shared with us. And one thing that is running across the two speakers who have just spoken is that therapy and the need of meeting as parents be treated as an essential service. But what worries us, and I think this is one of the things that those of us who prepared this webinar had at the back of our mind, the size, the available space for a family within an informal settlement. Lily has said 10 by 10. She's the one who is with the community at Ayani, and she can tell us 10 by 10 and all this number of children. Will that parent even have the room to do therapy? Maybe those are questions that we need to ask ourselves. I've had the call to Wilfrida to talk to the government. At the end of this webinar, we shall be agreeing whether Wilfrida will be alone, or maybe some of us within this conversation will accompany her so that we make a case. As I call upon the next speaker, I would like to remind us that there is something that is very interesting that is going on within the social media. Somebody says that COVID-19 is like a wife. You learn to live with them. You start by controlling them, then with the time you realize you have to live with them. I will not say it's like a wife. I'll say COVID-19 now is almost becoming a marriage. So you have to learn how to operate within this marriage. And therefore, we won't struggle with when will schools open, because I don't think therapy is necessarily going to be pegged on when will schools open. The children that go for therapy are not necessarily school-going children. We appreciate that a number of children access therapy in school. But I know because of early assessment and early intervention, we have very young children coming for therapy, as young as before they are 1 year. So when we look, when we talk about therapy, let us us not connect it to opening of schools. Let us cut our own waters and see where we end up. At this juncture, I would like to invite to the table Josephine Karari. Josephine Karari is a counselor for special needs. Karari, you've listened to us. I hear the children are depressed, the parents are depressed. We as service providers are not, I don't want to use the word depressed, but we are concerned. What would you tell us as the counselor at this point? Karari Josephine? Is she in the house? Okay. Josephine has checked out. I saw her, but she's not around. Could I have Eva? Hello, can you see her?
She just got back. She had dropped, but she's rejoined the meeting. So you can give her.
Karari, we could call upon Eva this time to talk as a counselor from experience. Eva Naptuni? Is Eva with us?
Eva has written that she has she's going to attend another meeting. And
all right. Then as I wait for Josephine to get her audios together, I will call upon Grace. Grace, one, you raised the idea of videos, and I think Sense International has given us guidelines that videos are available. You also talked about some parents are doing something. It's not like nothing is happening totally, but you also talked about gained milestones. What is the way forward from the conversation that we've had for the last almost 1 hour? Yeah, 1 hour. What is the way forward?
Yeah,
Grace,
thank you
from
so much,
Grace Institute.
Lydia. I've just, okay, about the videos, I thank God for STEM. At least we'll connect with them, and then I can be able to share it with the parents. And from what Lilly has said, well, somebody in a typical informal settlement might have a challenge with the videos. But I was thinking about a parent who may be in a setup that is not uptown, but still can access internet in one way or another. The videos can be quite helpful. Like most children nowadays, they have learned to cope, how to learn through the phone. We are learning through computers. And I'm imagining there are some who can still access such things. Now, we can continue those videos for the parents, and the situation of the parents who are depressed and feeling down and don't know how to connect from being mommy to therapist or daddy to therapist. I think there can also be an extra video of talking to parents. Like now, not a therapy session for the child, but like a counseling session for the parent, how to manage, how to cope, the encouragement, the emotional, the EQ, how the social cue, and how they can be able to manage this whole situation. Some places, okay, there is the issue of meeting, which is good, but still some parents are a bit hesitant because of this social distance thing, and some children, because they live with a disability of some sort, their immunity is down. So exposing them to other people or places is a bit of a scare for them. But I believe if we can have, like in our institution, I wish like KISE, we can work together more, and I can have a therapist, a professional who comes with the government regalia and the regulations, and they can do therapy from the institute, so that my children are able to access professional therapy and continuity, so that where the parents are stuck, at least the therapist will be able to help. If not, maybe like what Lily was saying, like distancing of time intervals. So we can come to KISE maybe at 12, another one at 2, another one, and in between the sanitization is done, the disinfection is done, and sensitization of everything is done. but still, I'm seeing not all parents are readily free to release their children back to therapy or therapists, but they need the therapy. Now that they have learned how to adjust at home in terms of helping, communicating with the child, eating with the child, playing with the child, I think they're looking, from my end, they're looking for now things that can help them from the therapy perspective to be able to bring it on board to their children, to their families. Before COVID came, our institute used to connect with the parents and would tell them. I used to take videos when we come for therapies and photos and instructions from the therapist and keep the parents afloat. So they kind of had an idea of how to go about it, and looking for a lot more so that they don't lose touch with the milestones we had made with the kids. So from my end, I could still pursue more of encouragement to the parents, more of encouragement to the children through the videos, and then maybe video calls for those who can access. Most people now are accessing phones. Of course, there are some settlements where they're not able to get it completely, but supposing there's even 5% who can access, because that one who can access can help the neighbor who cannot access, or can help somebody else in need, or they can record it and Bluetooth it to somebody else with a phone that has Bluetooth but has no internet. I'm just thinking that can be quite a milestone for my people and the children who really need a lot of therapy. My greatest concern would be protecting their immunity. Oh, I wind up. So yeah. My greatest concern would be their immunity. If their immunity can be checked on, then I'm sure most parents would be okay releasing their children for therapy. But for our institute, I would love to work with KISE more and have the therapist coming and handling the kids like before. I think that would be awesome.
Thank you, Grace. Elvis, from APDK. Somehow the cry here is that somebody has to give some instructions to parents. There is still some parents who will not feel free to start going for therapy, but as much as they don't feel free to start going for therapy, either because of the conditions of their children, they feel that they'll be predisposed, especially to COVID-19. There is this need to give parents some guidance of some kind. Let's start there, and then tell us about the gear. Tell us about how we could, those parents who are willing to come for therapy, how ready should we be ready for them? Elvis, APDK.
Okay, thank you so much, Lydia. Just maybe a point before I go into that is, let me maybe also make a remark on the video that we seem all of us heading to that direction, and we are all in agreement. I wish also to say that it is a really nice approach of delivering our services. And then I could also request that as much as we do this therapy on using the video, the parent should always be in touch with maybe a therapist in case of any concerns or any unusual thing on your child, such that the therapist and also the caregiver or the mother or the parent of the child should be in touch or in communication that they are doing the right thing while administering that online therapy. Back to the to the question that you have raised to me. There are two. I will answer it in two ways. One, if there is the facility which is ready to give out the essential service, or the facility which is giving out the therapy service. One, there are some things which have to be put in place for it to be appropriate to give service at this point when we have this pandemic. For instance, the therapy area or the therapy center has to be spacious enough, and it has to be structured in a way that there should be no crowding of clients seeking for that service. For instance, what we are doing in APDK, if it is possible, you give therapy on appointments, okay? Like that. Somebody is, you'll just be booking somebody to come for therapy, knowing that a client is coming at such a point to avoid that crowding and all that. At the same time, you must, the service centers have to place measures that have been laid out. For instance, there should be water points in each and every strategic areas for people to wash their hands, and also to, or where possible, they have sanitizers in strategic points. Three, about also the therapy area, should be very important. For instance, for us as APDK, any client who comes to the center must put on a mask. Okay, they should be on a mask, and they should sanitize before they go to there to receive the service. And then something that I
Hello.
Please unmute Elvis.
Oh, sorry. Where did I get lost? Okay, now I was saying
you told us to wear masks.
Yeah,
that
all
was the
the
last one.
Yeah, so all the clients who come for the service must put on masks. They must wash their hands or sanitize before they receive service, and they must maintain social distance when waiting for, or when in the service delivery center. Now, another issue that I'll mention, like for us in APDK, at the main gate is somebody, a staff who is there to make sure that they do maybe like a screening. It's more of what is called a triage area, whereby somebody is being measured temperature to ensure that precaution is being taken care of before somebody proceeds to the service. Now coming to now the area whereby the person administering maybe the therapy. I've mentioned that the parent and the service, the person receiving the service must be on a mask. Now, the therapist or the person giving out the service must be in the right gear. One, they must be on protective gear, right from the head down. Use of PPEs. That is something that is unavoidable when you are giving out the service. I believe when I mentioned the PPEs in a medical setup, the person who is giving understands all about that. Surgical mask, not using the reusable mask, surgical mask to avoid contracting or also transmitting. So that is briefly what I could remember to mention for now. Thank you.
I think you're guiding us well, and those of us who feel challenged enough to continue offering services, we are already ticking in the boxes to see what is available so that we can really be able to take care of the children and the parents who really rely on our services. I have two people who have wound up this conversation, but I want to give 1 minute to a counselor, and because I can't see Josephine, I will ask Sarah Deuri to take a minute and talk to us. Oh, Karari is up. Okay, fine. Karari, you may talk. Josephine? Sarah?
Hello, Lydia?
Yes, Josephine, we can hear you.
Okay, thank you.
Yeah,
Sorry,
you have 1 minute.
Yes, I had challenges. I really want to thank everybody who has participated in this very informing session. I realized that we have a lot to learn from each other. And as much as we are caregivers for therapy for these children, maybe I just need to mention 1 or 2 things about the psychological support that these children need. One thing I appreciate, and we appreciate for all children, not just for children with special needs, is that many of them are undergoing emotional stress or psychological distress the fact that they are at home for many days, which they have not experienced before. And it's no different for these children with special needs. And I think that has been expressed by different parents. And Eva put it very well, that it is not it's not an easy task. Now, I think these children, what we need to know is that when they experience emotional need or needs which they have right now, it is for us parents and even for us service providers, we need to understand these needs, these emotional needs, and the fact that they may be expressed in different ways. Some children will express that emotional need by just keeping quiet. They'll be very silent. And it becomes very difficult even for the parent to figure out exactly what is happening to their child or what help they can give to their children. And sometimes it even becomes distressing even to the parent. Other children will express it with a lot of anger, and they become hyperactive. Others will even become violent. What we need to understand is that all these emotions are valid. And as parents and caregivers, we need to give a lot of empathy, to empathize with these children as they try to express their emotional needs in different ways. So,
Josephine, 30 seconds.
So there are many ways that maybe what parents can do just to try to be creative, as many of us have expressed, engaging them in interactive activities, playing and drawing, having regular routines and schedules at home, and most importantly, Lydia, to create a peaceful atmosphere at home. There's been a lot of talk on domestic violence in the homes, and I can only imagine how the children are affected, and especially those children with special needs. So some will witness this violence, others are a target, unfortunately, of this violence. So if that was taken care of, then because definitely it would leave a lot of trauma on these children. And what will happen is that they will express that with a lot of destructive behavior. So it is important that we try to create a peaceful environment for our children, and for parents, let them be empowered, as I said last time. Let them, yes, empowered as in,
Just go on, Josephine.
Empowered by getting the right information from the right sources, watching and reading a lot, but also avoiding that destructive news. Even as we discuss COVID at home, let us be very careful on what we are discussing and how we are even expressing it to our children, so that we don't express a lot of fear. So Lydia, I think that is important. I just needed to mention about maybe one or two psychological support that we can offer to our children at home. Maybe next time we can talk about the parents, who I know also need a lot of psychological support and psychosocial support. Thank you.
Thank you, Josephine. That is from the voice of a counselor. Wilfrida, you can imagine I've kept the last for you because there's a lot, and as you address us, I'm looking at a way forward where maybe a few of us would like to come and meet you at the ministry or wherever your office is, and or we could have a meeting of a few organizations or a few people here representing organizations, so that we are able to, as Alphonse said, champion this cause that therapy is an essential service, and really bring out the fear of lost milestones for the children who have been undergoing therapy. And some of the children stopped going for therapy at a point where it was extremely critical that they don't skip any therapy. And because I have been able to supervise a little bit, or attend to a few therapies of parents, I know it is not easy for parents to do therapy on their children. I sometimes meet the children screaming and I ask the therapist, why is the child screaming? And they say, it's not the pain, they're just uncomfortable, or the child is just afraid or something like that. And once or so, I've met parents also crying, especially at the beginning or when they start beginning to go for therapy. And not because of anything else, it's because they just empathize with their children. So Wilfrida, you have a big heart to wear at this particular time, and I will give you as much as 3 minutes to really address all the issues that have been raised in this forum. Please switch on your video.
Okay. Okay, thank you, Lydia. I hope you're hearing me.
Yes.
Yes, and most welcome. I can hear you saying that you would like to come to my office for a meeting. Yes, for a few people it is allowed and you are most welcome.
Thank
Please, we can have a phone call later on and just give ourselves an appointment for this meeting.
Yes.
Yes, I hope that will be okay, so that we can thrash out all these things that I've been hearing being said. I want to go back up to the protocols. Somebody asked about protocols, and I want to say that there are several types of disabilities, and each disability has its own protocol with different rehab specialists. When I say rehab specialists, I mean the professionals who offer therapies, because therapies are many. There's speech therapist, there's occupational therapist, there's physiotherapist. So all those therapies, we put them together and we call them rehab in one word, rehabilitation or rehabilitative services. So all those have different protocols for different children with different challenges or different impairments. And that we cannot go into at this level. But from what I'm hearing and what I'm gathering from everything that we've talked about is that rehab services are essential services, just like any other services within the medical profession. Long time ago, before COVID came, and much earlier, there was something we used to call community-based rehabilitation. And from all that I've heard here, it's like we really need to go back there where we had the rehab people going into the communities to offer services, going into special schools or even into ordinary schools, because now learning became integrated and children with special needs are also in normal schools. So I'll put that into paper and take it forward.
Wilfrida, we call them ordinary school. All schools are normal.
Okay.
Yes.
Ordinary schools, yes. So I'll gather all the information that you talked about and put them and press this forward to the CS Ministry of Health, so that they can also feel the weight of the rehab services being essential. But I really welcome you, Lydia, to my office and your group. Please come when you are ready so that we can put all these concepts together and take them forward. About videos, video has become a new concept, and I think the rehab people cannot now move away from it, because it's like we have to put all the things that we do together for children in small bits of videos, because you can only do a few exercises or a few stretches or a few guidelines to process what you are doing to a child. You can't put all of them together, and sometimes maybe it's so important for a professional to see the videos that you're talking about, so that the parents are advised on the way forward and on the right way, so that children are not harmed while the parent, who is not a therapist, is giving a service. And I've also heard from you people say that the parent is not a therapist. Although from our end, we really urge that the parent incorporate what the therapist does, so that she does what we call a home-based program. Whatever the rehabilitation team does in the hospital or in the school, or even at home where the child is, can only be done for a few minutes, like 30 to 40 minutes. The rest of the hours, the mother or the parent is left with the child. So we expect that when the mom or dad is left with this child, they carry on the program at home. So we always encourage home-based program or home-based care, which the parent takes back to the child from the therapist. So let's not move away that this is just the therapist to do it. The therapist has very little time with the child, 30 minutes, 40 minutes, but the mother has all the 24 hours with the child. So we need to incorporate into ourselves that there's that home-based care that the mother or the parent has always to carry ahead. So me, as I wind up from my side, I've seen the need and will urge the government that the community-based health workers must incorporate the rehabilitation team so that wherever these children are, instead of them coming to the hostel, they can be reached by the professionals where they are in their comfort zone. And as Elvis had put it earlier, all of us have to take care of ourselves, both the parents and even the children. Some of them, if they are able to wear a mask, they are encouraged to do so, but of course with the supervision of the parents. And the health worker must always be in those masks and sanitize as is required by the WHO and by the Ministry of Health. So as we take care of all this, we still have to remember the guidelines. Our challenge and our biggest challenge, especially in caring for persons with disability, is that the social distancing cannot work in that setup because you have to really be close with the person you are taking care of. It is actually about touch, it's about giving exercises. So it is a matter of being in the right gear, being in the protective gear as a health worker so that you don't transmit an infection to the client, and also putting the client in the right gear by letting them put on masks. So Lydia, those are the few remarks that I have for you, and you're most welcome anytime that you let me know that you are able to come.
Thank you, Wilfrida. We are happy that you have felt us as a people who offer service in the community. And I'm very sure that this webinar that is seriously supported by TAF, the Action Foundation, will pick up between KISE and TAF, and we'll call upon a few people, now that you know that we cannot be a bigger crowd, to represent us. At the end, Maria will tell us whether those who feel that they have the time, the muscle to go, we meet Wilfrida and see whether we can cascade this one upwards. Maria will give us a direction on how we show interest so that then we are able to put a team together and most likely do this next week, so that when we have the next webinar, which we normally have to have every fortnight, then we shall be having something to report. Members, I know we have gone 5 minutes past the hour. Allow me to, at this particular point, first of all, let me call upon somebody called Ruth Mudami. I'm calling on Ruth Mudami, not that I know her. She has a very nice something. She's called Mama Africa, to just give a word of thanks to our panelists who have really articulated issues on behalf of all of us and who have created time for us. And we are grateful. Please, Ruth Mudami.
Yes, I'm here.
Yes, please introduce Mama Africa. I don't know who Mama Africa or what Mama Africa is.
Mama Africa is an organization where we offer counseling, trainings, and mentorship programs for children caregivers, mostly in churches and schools, and wherever the children are found. So in this case, I'm here as a counselor, and I sincerely appreciate for Grace, who invited me into this forum.
Okay. So you say thank you to our panelists as a participant in this.
Yes.
Just pick 3 things that you have gained from this discussion.
I must say, first of all, I found very knowledgeable people who have given the information. Number 2, the articulation of every need from the people who have spoken, and I've really appreciated. And then the cry out loud for the children who are needing our help. out in the community at this particular time of COVID-19. It was very well articulated, and thank you so much for all the panelists.
Thank you, Ruth.
Thank you.
Maria, you will allow me 1 minute for Sarah Deuri. They say nothing for us without us. Allow me to introduce Sarah. Sarah is a counselor. She's an officer who works at the assessment center, but she's also an adult who has grown up with the CP. Sarah, if you may allow me, could you talk to us from what discussions you've had? What are the fears of the parents, or what do you carry from this discussion? Sarah, in 1 minute. Deuri?
Good afternoon.
Good afternoon.
Yeah, it has been a very informative meeting, and from where I sit, I hear the cries of the parents day after day, and especially a lot of anxiety. And I think as the discussion goes on, we are in the right direction on how to reach out to them and how to intervene to their needs. Thank you.
Thank you, Sarah. Members, I'll put my video on for those who don't know Lydia Chege, that you may just have or familiarize yourself with this face. I've been your moderator for the last 2 webinars, and I'm extremely humbled that I've gained such wealth, and we've been able to carry on very well. I am extremely humbled that Elvis and Wilfrida have given us some food for thought, and they have also opened an avenue with Elvis telling us that therapy is an essential services. I think it gave us the go. And we are happy that Wilfrida has opened the doors at the Ministry of Health, and I'll be looking forward to Maria Oyare guiding us on how we shall go to the ministry so that we can start offering services where they have stopped. And even if we don't get the children, at least Lilly, we have the parents come together for psychological support and for us to give them guidance. As much as Wilfrida has said that parents do home-based therapy, I believe this can only be given under guidance, where we reached here last week, this is what we do for this week. Because from the school of thought that I come from, we say that is not measured then can never be achieved. We have to measure the gains of the child as we go along. With those very many words, I wish to thank you and hand you over to Maria Oyare, our host. Maria, hi. Looking pretty. Take over, please.
Yeah, thank you everyone
Wind us up
today, and for accepting our invitation. Special thanks to all our panelists for the enriching discussion, and to you all for also helping to enrich it further. So we will be sharing the report from the meeting. Thank you for the comments, even from the chat. I've seen that this discussion has been fruitful for all of us. We will be sharing the report, and I do encourage you, if you haven't filled in the survey, please do so. So I'm very happy with this meeting because we have a way forward. We shall plan the visit to the ministry. I shall send off some communique on the same, and hopefully that will result into a pathway for resumption of therapy services or support for our children and families. So we shall also share the next meeting dates as well as the timing. So please look out for your emails. I'm certain I have all your emails. We have all your emails. If we don't, please fill in the invite request, and we shall get your emails, or you can put it up on the chat box. I thank so much Lydia. All of you can agree with me that she has done incredible moderation. So on behalf of all of you, I'll do the inclusive clap. Asante sana tena, Lydia, also for your partnership in making this possible. And finally, I'd like to thank my colleague Wanjiru. She has been the co-organizer alongside myself for this webinar. So yeah, see you soon in 2 weeks, and please watch out for our updates and our email. And asante sana once again.